My name is Andrew Gray, and I serve in the Alaska State House representing the UMed district of East Anchorage. Outside the legislature, I'm a physician assistant. I've been doing that job for over a decade in a variety of settings, including the Alaska Army National Guard, the Alaska VA, a couple of emergency departments, and I currently work in an urgent care in Anchorage. Yesterday, in a hearing of the House Labor and Commerce Committee, a physician who had been asked to testify about private equity's effect on the cost of healthcare in Alaska took that opportunity to spread misinformation about physician assistants and nurse practitioners. She spread the mistruth that PAs and NPs are responsible for the high costs of healthcare in our state. Here is exactly what she said.
But what the companies find is that it's cheaper to replace a doc with a PA or a nurse practitioner. And there are a lot of national studies that show that a lesser trained and lesser experienced practitioners actually may be cheaper to hire, but more expensive for the healthcare system because of ordering more tests.
The American Medical Association study she is referencing was of a small group of nurse practitioners at an emergency department in Hattiesburg, Mississippi. The extrapolation of this one small study in Mississippi to the entire country is unscientific and irresponsible. When we look at the scientific literature more extensively, we see a very different story. A meta-analysis of 39 different peer-reviewed studies published in PLOS ONE in November 2021 showed that the quality of care delivered by a PA was comparable to a physician's care in 15 studies. And in 18 studies, the quality of care actually exceeded that of a physician. In total, 29 studies showed that both labor and resource costs were lower when the PA delivered the care than when the physician delivered the care. The bulk of the scientific literature shows that PAs and NPs are able to deliver the same care as physicians with less cost. The truth is that in spite of what a small number of Alaska physicians are saying, we are not part of the problem. PAs and NPs are part of the solution.